and then use caution when sitting. So be careful if you're sitting down in a chair that has wheels on it, if there's handles, make sure you reach back for the handles on the chair so you know that's there behind you and that it's not going to move whenever you go to sit down in it. So what if a fall does occur at home? The first thing you want to do is remain calm and assess the situation. That might be challenging, but you really do want to just kind of calm yourself and be like, okay, now what do I need to do? Okay, you want to make the decision whether you can get up safely. If you think you can get up safely, if you're not in a lot of pain, you want to get to a sturdy piece of furniture, which I have some pictures on the next slide that'll help you out with that. If you cannot get up, the first thing you want to do is either use that cell phone that's in your pocket or your first alert button, your personal response system, and make that phone call so you can get help as soon as you can. If you don't have a first alert, don't have a phone, unable to get there, you just want to make some noise as loud as you can. There's probably neighbors close by. Somebody might be out walking their dog or something to that effect. So to get somebody's attention. So these little pictures here are showing this lady who happened to have a fall at home, and she's assessed her situation and realized that she thinks everything's okay, she's not in pain. So from number 1, she's laying on the floor. She wants to get closer to the chair in the picture number 2. And then once she's there, she wants to get up on her knees and use that sturdy chair to help get herself up in there. So is my family or loved one at risk for falls? I provided a short handout that has some questions on it about whether you or a family or a loved one might be at risk for some falls. I found this at the CDC website, Center for Disease Control, so this information's out there on the website, if you're looking for more information. But basically it goes through a lot of the things we've talked about already. Have you had falls in the past? If you say yes, then you're probably more likely to have a fall in the future. If you take 4 or more prescription medications, if you have a difficulty walking or standing, if you use an assistive device, if you have dizziness or feel unsteady on your feet. So items such as that. And this handout's nice because it tells you, if you check the yes box, some things that you can do to help that situation and help prevent falls at home. So these are some of the links that I use: National Institute on Aging, and like I said, the Center for Disease Control. Lots of good information on those websites. And that is all. So if anybody has any questions for me or any of the other presenters, we can answer them for you. Good. Yes.
Could minor dizziness from standing up in a sitting position or from turning quickly, could that be a symptom of BPPV?
Do you want to answer that? So his question was if standing up from a sitting position too quickly or turning and becoming dizzy, if that's a symptom of the BPPV that was spoken about earlier. And I'll let Dr. White answer.
So we describe the condition fairly simply, but the reality of it is that it doesn't necessarily show up the same in, or what we say in medicine, present the same in everyone. Now you described 2 separate movements there. One was standing up quickly. Typically that's because you don't get enough blood up into your brain and the blood pressure doesn't adjust properly. And then you said turning. And again, those are 2 different movements. The turning would be more commonly associated with a benign positional vertigo, but I have been fooled by patients who come in and say they get lightheaded when they stand up, and you test them and they have benign positional vertigo. Now they may have both problems, but like a lot of things in medicine, it's not necessarily quite as straightforward as the slides suggest. That's maybe why you go to school for a while to learn about these things. Tinnitus. So it is my firm belief that this is a wonderful democracy. However, when we're talking about tinnitus, I think we need a benevolent dictator. Because you would think for a problem that does not have a very good treatment, which is often true, not always true as Barb said, but often true, there would be very few treatments. But in fact, because of our capitalistic society, you have a very common problem that doesn't have a very good treatment. There are many, many treatments, some of which are pure snake oil. And you open up any AARP magazine, which I of course never do because I'm not old enough. You can see, I'm sure in the back, some sort of drop treatment. Buy these drops for ringing in the ears. And what I say to my patients is, make sure you don't spend a whole lot of money, and make sure you're not going to hurt yourself. And if you want to try some of these things, then I think that's reasonable. But overall, there is no easy, great treatment most of the time. That doesn't mean there's nothing we can do for people who are very troubled, but the best first treatment is go home and live with it if it's not too bothersome. Any other questions we can answer for anybody? Well, we'll be around afterwards if anyone wants to ask us any questions. Thank you.
Thank you.